this video, we will discuss how isotretinoin works in the body from the moment it is taken orally to its final impact on cells and clinical outcome. Isotretinoin is a synthetic derivative of vitamin A, which is known for its effectiveness in treating of severe acne. Isotretinoin offers remarkable therapeutic benefits for acne, yet it carries significant risks and side effects. In this video, we will discuss how isotretinoin works, why it's considered so potent against acne, and which side effects make it a drug that must be used with extreme caution. The major question is, why do we use isotretinoin for severe acne? To understand this, we have to know how acne develops. Acne pathophysiology involves 4 key factors: excess sebum oil production, hyperkeratinization, bacterial overgrowth, and inflammation. Here we can see a diagram which shows that acne is one of the most common issues nowadays in medicine. On the right we can see different subtypes of acne. For a better understanding, let's illustrate the pathogenesis of acne step by step, and after we'll discuss how isotretinoin can prevent acne formation. So here we have skin surface. Skin surface is composed of keratinocytes that form our superficial layer. It's a hair follicle, and inside the hair follicle there is hair. Hair has sebaceous glands, which are composed of sebocytes. Sebocytes produce sebum oil, which normally provides protective effect. The first reason why acne develop is increase in keratinocytes turnover. In acne-prone skin, increased keratinocytes turnover leads to hyperkeratinization. In this state, keratinocytes cannot shed properly, and because of this, they excessively accumulate on the skin. This results in blockage of the hair follicles with formation of comedones. The second feature of acne-prone skin is excessive secretion of sebum oil by sebaceous glands. Accumulation of sebum oil combined with blocked hair follicle with time will cause pain and inflammation. In addition to this, blocked follicles create an anaerobic environment that promotes growth of bacteria, leading to inflammation and acne lesions. Isotretinoin is typically given orally in capsule form, and being lipophilic substance, it's better absorbed with high-fat meal. So isotretinoin should be taken with fatty meals for a better absorption. Once isotretinoin comes into the blood, it undergoes metabolization in the liver, and because of this, isotretinoin is considered hepatotoxic agent. Liver metabolized isotretinoin with formation of active metabolites as 4-oxyisotretinoin. Because isotretinoin is a derivative of vitamin A, isotretinoin has high affinity for skin and sebaceous glands. This feature also explains the potency of this drug in acne treatment. First of all, isotretinoin inhibits growth and activity of sebocytes. This provides decrease in production of sebum oil, which can prevent formation of acne. The second feature is that isotretinoin causes decrease in turnover of keratinocytes, and by removal of shredded keratinocytes, isotretinoin reduces formation of comedones. With unclogged pore, bacterial proliferation decreases, which also contributes to reduction in severity of inflammation. So, exactly by reduction of sebocytes proliferation and by normalization of keratinization, isotretinoin significantly diminishes formation of acne, and many patients experience permanent or at least long-term remission even after one complete course of isotretinoin. But this drug has also quite significant side effects. First of all, it's a highly teratogenic agent. In addition to this, isotretinoin has significant hepatotoxic effect, and also it can cause hyperlipidemia.